exploring new paths leading to new possibilities that challenge conventional thinking and lead to new and innovative solutions. Stay engaged and informed for creative insights that support a mature generation. Welcome to New Age Aging. Welcome to New Age Aging. For today's episode, we will be taking a closer look at our Medicare system. With so many of us coming of age, it becomes more important that we become familiar with this healthcare system. My guest and I will be discussing this system so that we can make our best enrollment choices, and he will be showing us how to manage the coverage and benefits once we have signed on. And with us today, to help us navigate this topic is Ted O'Connor. Ted leads the retiree solutions practice at Borislow Insurance, a leading employee benefits agency in New England. It's based out of Methuen, Mass. Ted is a graduate of Trinity College and has been an advocate regarding Medicare education, plan navigation, and enrollment assistance for over 6 years. During that time, Ted has hosted Medicare seminars and webinars for hundreds of companies and has enrolled several thousand individuals in individual Medicare plans. Please join me in welcoming Ted to our show today. So, welcome, Ted, to New Age Aging. You know, I was joking with my wife. I've been having this dream of having this TED Talk for a while. I'm finally going to have a TED Talk.
Welcome.
I know, that was a corny joke. But in order to give our conversation a bit of an anchor, I wonder if you can just start off by giving us a brief history of the whole Medicare system as we have it here, if you could, please.
Sure. President Harry Truman, back in the mid-40s, was the first president that came up with a national health insurance for the public. But that bill did not get passed, kind of sat there for a few years. Then President Kennedy was really the inspiration behind Medicare. He saw a national poll that had 56% of Americans over the age of 65 had no health insurance coverage whatsoever. So eventually that bill got passed, signed into law by President Lyndon Johnson in 1965. 1966, Medicare came into effect, and that was really offering health insurance to anybody over the age of 65. And that was Part A and Part B. Part A is inpatient hospital coverage, Part B is outpatient services. And then in the 70s, President Nixon added the eligibility to Medicare for those who have long-term disability, which is otherwise known as SSDI now, Social Security Disability Income.
Okay.
In the 80s, they regulated Medigap plans. In the 90s, what was called managed care plans, they added Part C Medicare Advantage plans. And then in the 2000s, they added Part D, prescription drug plans. So there's quite a few letters. And why Medicare is very complicated and very confusing is they have all these parts. So it's a matter of how you put them all together.
The history of this thing is that every so often you tack on more and more.
Yeah,
and more.
hopefully they have enough parts now. So.
It's funny because with the changing demographics, which is what this show is all about, with the changing demographics, what do you predict will be the upcoming changes? Because the boomers, and we're just going to be taking over the population. That's a slight exaggeration.
Yeah.
Won't that affect Medicare and its structures?
It's growing. Right now, there are 49.5 million Americans that have Medicare right now. And they say by the year 2030, with the baby boomer generation, there's going to be 80 million.
So that's going to demand some changes.
Correct. Well, I think they have it in place right now, all the parts. There are a lot of them, like with Part D, the lovely coverage gap donut hole.
Yes.
That is shrinking every year.
Uh-huh.
So they say by the year 2020, there will be no more donut hole, hopefully, for those
Okay.
people who...
We'll explain to
We'll get
viewers
it,
out there
yeah.
what donut hole means.
Sure, sure.
Because that was hard for me to understand as well.
Boy,
So we'll give it a chance for our viewers to understand that.
Sure,
So,
but a lot of insurance companies, there's quite a few Medicare, major insurance companies throughout the country. They're constantly adding new products, and so they have to take care of 80 million Americans pretty shortly. So,
oh. Is Medicare, a question that just occurred to me, is Medicare issued by private companies or by the federal mandate?
Medicare is for the federal government,
Okay.
which is Part A and Part B. That is what is called original Medicare. Once you have original Medicare in place, there are two road paths you can go down, and those road paths is Medigap in Part D versus Part C Medicare Advantage, and those plans are all with private insurance companies.
Okay. So the whole system brought into effect private corporations as well, private insurers to
Correct.
help out
Correct.
the whole system.
So, and those plans are needed.
Yeah.
I mean,
Oh,
with
yeah.
original Medicare, there's a lot of holes in Part A and Part B, and there's no prescription drug plan given to you. There's no Part D drug plan that when you're 65 that's available. You have to go find one.
Interesting.
And
Interesting.
so that's why the private insurance companies come through.
Okay. Well, let's get into those of us who are just coming into this system. There's just so many choices. The landscape looks somewhat complex. What do I need to know to make the right choices when I sign up for this thing? What about Medicare do I need to know?
Well, when you sign up, there's two different worlds. When somebody's turning 65 and you do not have health insurance coverage, you do not have employer coverage, there is a window of when you can sign up, and that is what's called your initial enrollment period. And that's a 7-month window that is surrounding your 65th birthday. So if somebody's turning 65 in April, you have 3 months prior to enroll, the month of, and 3 months after.
Okay.
Now, that's one world, when somebody does not have employer coverage. But if you are an active employee on a group health plan or the spouse of an active employee on a group health plan, that initial enrollment period, otherwise known as IEP, that's bypassed because you have credible coverage in the eyes of Medicare. You can then, not sign up for Medicare at that point. You can sign up for Part A and not Part B. And then when you do retire, let's say at 68, or you're the spouse of an active employee that's retiring, you can then sign up for Part A and Part B and not be penalized by Medicare. In the eyes of Medicare, retiree coverage is not considered credible coverage. It is active employee coverage.
Okay. Now, you just mentioned not be penalized. Can you talk about the penalties that might occur if I do not? Give me some words about these penalties. I'm not sure what they are.
Sure. You can pay a penalty on your part when somebody is eligible for Medicare, when you turn 65 years of age. If you do not sign up for Part B in particular, and you sign up 3 years later, they penalize you 10% per month.
Per month, wow.
Well, over a 12-month period, but it's a 10% penalty for every 12 months that you do not have coverage. So that can add up for you. That's one penalty.
Is that a permanent penalty?
That stays with you for your entire lifetime.
Oh, really?
Yes.
That penalty stays with you?
That stays with you. And that's on the 10% of the Part B premium at that time.
Okay.
So if you sign up 3 years later, you can have a 30% penalty for the rest of your lifetime. And also on Part D prescription drug plans, they do give you a 1% penalty for every month that you do not have credible prescription drug coverage. When somebody is turning 65 years of age, if you are collecting Social Security at that time, Medicare signs you up automatically for Part A and Part B.
So it's automatic?
Automatic when you're collecting Social Security. So in that scenario, if somebody is an active employee on a group health plan or the spouse of an active employee, typically what somebody will do in that case is they will keep Part A because there's no cost to Part A as long as you work 10 years of your lifetime and paid Medicare taxes, and they will defer Part B because there's a premium to Part B. And then when that person does eventually retire, they can then sign up for Part B and not be penalized because you were an active employee on a group health plan or the spouse. And on the other side of that equation, when somebody's turning 65 years of age and you are not collecting Social Security and you're an active employee in a group health plan, you don't need to sign up for Medicare. You don't have to sign up for Medicare. Again, you can then sign up for Part A and or Part B and not be penalized because, again, you're an active employee in a group health plan.
So that's one side of it. Now, collecting Social Security at 64, 65 comes around, I'm going to be automatically signed on.
Automatically sign up.
My Social Security payments will be reduced by the amount that Part B.
Part B premium.
Okay. Is Part B national or regional? Is that
National.
Okay.
When you, on the Part A and Part B, when you sign up for Part A, as long as you or your spouse worked 10 years / 40 quarters and paid Medicare taxes, when you do sign up for Part A, there is no additional cost. Part B is based on your income. So Lee, if you were signing up or somebody was signing up for Part B in 2016, they're going to look back 2 years. The Social Security links right up with the IRS. They're going to look at your 2014 taxes. And there's a line on your taxes called your modified adjusted gross income. And there's a standard premium, which right now in 2016 is $121.80. That is for somebody who's, as an individual, has an income less than $85,000, or as a married couple, $170,000 or less.
Okay.
So if that is your income 2 years earlier, you'll have that standard premium for Part B.
Okay.
When you sign up for Part B, if you are collecting Social Security payments, that Part B premium comes out of your check automatically. If you are not collecting Social Security payments, you will get billed in that quarter.
Okay.
And then there are 4 other different tier levels based on your income.
So the Part B premium is tiered. Is tiered. Is that what it is?
Correct, based on what your income level is.
Okay.
And it caps off at $389. And so
Okay.
it can, $121.80 is the lowest, and it can go up to $389 based on your income.
Okay.
And that's not a set number either. It adjusts every year.
Okay.
So for 2017, they're going to look at your 2015 taxes.
Okay.
So if you had a
Now, Part A and Part B, these are more or less simple choices. It's C and D where the complication comes in.
Yeah, so when somebody has, original Medicare is Part A and Part B. Again, Part A is your inpatient hospital coverage. Part B is your outpatient services, your medical services. Once somebody has Part A and Part B in place, there are 2 road paths available to you in Medicare. Road path number 1 is where you would get a Medigap and a Part D drug plan. Those are both plans that are in addition to original Medicare A and B. And the other road path is called the Part C Medicare Advantage plan. And that's a replacement plan to original Medicare A and B. So
Okay.
2 road paths, Medigap and Part D versus Part C Medicare Advantage.
Okay, I have to see if I have. Test me here now. So,
There's a quiz after that.
yeah.
A and B is original Medicare.
Sure.
A road path number 1 is getting a Medigap plan and Part D. The Medigap plan is the plan that fills the holes in original Medicare A and B. In other words, pays the co-insurances and deductibles. So the Medigap card is for your doctors and your hospitals. And then with that, you get a separate Part D prescription drug plan. So in essence, you have 3 cards. You have your Medicare card, your red, white, and blue, which you can just tuck in your wallet or pocketbook. Then you have a Medigap card for your doctors, hospitals, and a Part D drug plan for the pharmacy.
So there's 3 policies there.
So that's road path number 1.
Okay.
The other road path is a Part C Medicare Advantage plan. And again, it's a replacement plan to original Medicare. So what it does is it takes all the benefits from A and B, converts them into a Part C plan, and it adds Part D. So now you have 2 cards as opposed to 3 cards. And the road paths are apples to oranges, bananas to turnips.
Well, how do you know which path you should go down? What's the basic decision tree that steers
there
you?
are a lot of things to consider, but there are a lot of what's called lifestyle questions. I don't ask these questions. People tell me. And things to consider. Do you have 2 homes? If you winter in Florida or summer up in Maine or do extensive traveling, you probably want to think Medigap. Medigap plans are portable plans. You can take them anywhere throughout the country.
That's important.
It's very important. Any doctor or hospital in the country that accepts Medicare will accept any Medigap plan. So for that person who lives here in New Hampshire and winters down in Florida, that Harvard Pilgrim card is going to work for them just as well in New Hampshire as it will in Florida. So that's certainly something to consider. Where on a Part C Medicare Advantage plan, those are managed plans. Those are HMOs and PPOs, very similar to what a group health plan is like.
But that's more regional.
That's more
oriented.
regional. That's where you have to pay attention to your doctors and see if they accept the terms and conditions of the plan and really participate in the plan. I mean, from my standpoint, whenever we're exploring a Medicare, somebody wants to explore a Medicare Advantage plan, my worst, you always want to make sure their doctors are in the plan, especially if it's an HMO. You don't want to find out that all of a sudden your doctor's not in the plan.
Yes.
And you can't unwind something in Medicare. Again, it's all about election periods. So when you sign up for a plan on January 1st, especially Part D or Part C plans, you're with that plan until the next year, unless you have you're moving or something like that, where you have a special election period. But
so you have an opportunity to explore options once a year, but only during that time where you can.
Correct. Yeah, it's
So you're stuck with your choices for a little while.
Correct. Yes.
So if I'm intending to travel around the country, then the Advantage plans would be better suited to me. If I'm the
Medigap plans.
I'm sorry.
Yep.
I had to.
That's all right. That's all right. See, I told you it's complicated. So
I'll get it right. Don't worry.
Again, Medigap and Part D, and then
I think I may need a coach. I'm not sure.
That's all right. So for somebody that does lifestyle questions, as I mentioned, if you do extensive traveling, overseas travel, foreign travel coverage is covered by Medicare plans as well.
Is it really?
Yes. And so for the person that does a lot of traveling, you probably don't want to be in a Medicare Advantage plan because Medicare Advantage plans is the region.
Yeah.
So if you go outside, like for that person who travels to Florida and they have a Part C Medicare Advantage plan, the only thing a Medicare Advantage plan is going to cover outside of your region is emergency room coverage. Where a Medigap plan, any doctor or hospital in the country that accepts Medicare will accept any Medigap plan. So there's a portability factor, which is very important.
What other, I mean, traveling around is one of the factors that's going to affect our choices there. What are some of the things that's going to affect our choices, which path we take?
If your doctors, if you live, if you don't do extensive traveling and all your doctors happen to be in the managed plan, that might be the plan to consider.
Okay.
Also, there's a difference in cost.
Yes, of course.
It's very important.
What's the difference?
The Porsche might just look as good as the Lamborghini, but there's a difference in cost. Medigap plans, you pay more for them. Medigap plans, yes. They're more expensive than Part C Medicare Advantage plans. When you have again, road path number one is when you have a Medigap and a Part D. Across the country, Medigap plans are labeled by letters, and there's about 9 different variations, A through N.
Are they standardized across the nation?
Standardized across the nation.
Okay.
Yeah, it became standardized in the 80s.
Okay.
Every insurance company can choose to offer what letters they want in certain states. But there is one common plan that every company offers, and that is called Medigap Plan F. F as in Frank. I would say Medigap Plan F is the most coveted plan, the most desired plan, because this is the plan in particular that fills every hole, in other words, pays every coinsurance and deductible in Part A and Part B. So when you have a Medigap Plan F, and that is the case here in New Hampshire, you pay a premium to the private insurance company, but then on the back end, as long as your doctors and hospitals accept Medicare and what's being done is Medicare approved, these plans in essence give you what I call first dollar coverage. There's no deductible to satisfy, no co-payments, no co-insurances. Medicare pays first, the Medigap plan pays what somebody's responsible for.
So I can understand why that Plan F would be very coveted. What's its cost? I mean, in relation to the other plans, what's its cost like?
Every state is different. Your rate can be determined, again, state to state, can be determined on your date of birth, your gender, zip code, smoker, non-smoker. Certain states have what's called community rate, where they have one flat rate for each plan for the entire population.
Interesting.
I would say, if you're looking at a median number, just to give you a number, about the $185 range a month for somebody that's new to Medicare. And then, certain states can go up based on your age.
Now, it sounds to me like for Plan F, we have the same Plan F all around the country, but that same Plan F can cost different amounts.
Correct.
Depending on where you are.
Correct.
That seems a bit, I mean, I would have to analyze where I want to live.
Yeah. Well, it's funny you say that. I have clients that live in Massachusetts and live in Florida. And it's a lot less expensive in Massachusetts than it is in Florida. And a lot of it's based on where you pay your taxes, and hopefully it's in Massachusetts because you can get a plan and you can take it with you to Florida. So,
Okay.
so
That's
it's
right.
all-
You said Medigap is covered everywhere.
yeah, so on the Medigap, again, because it fills the gaps in Medicare,
Mm-hmm.
you shouldn't have to pay anything additional out of your pocket for doctors and hospitals. As long as your doctors and hospitals accept Medicare and what's being done is Medicare approved. And again, with that, you couple a Part D drug plan, which I'll be happy to get into with
Yeah.
you.
Okay.
And then again, Part C is the replacement plan. So
Mm-hmm.
Part D, prescription drug plans came in the market in the 2000s. When somebody is choosing a Part D drug plan, you cannot just randomly pick any plan. You have to do your homework or have somebody do your homework for you.
Mm-hmm.
Every insurance company has different formularies. They have different tier levels. One company might have a drug at tier 2, a second company might have that same drug at tier 4, and a third company might even cover it.
Wow.
And a lot of these insurance companies now have preferred pharmacy relationships. So what I do when I help somebody find the Part D drug plan is I get a list of somebody's medications, including the milligrams per pill, the frequency they take it, and your top 2 choices of pharmacies. And then I do my homework, and it's available on several different websites, including Medicare.gov, which is the U.S. official government site for Medicare. And you get on the system, you input your drugs, put in your zip code, and you do a search. And these websites do their math. Where all of a sudden on the top of the screen, the lowest costing plan will appear for Lee, and as you scroll down the page, they become higher cost.
I want to divert just for a second. You mentioned Medicare.gov. Now, they issue a handbook that's mailed to everybody who signs on. This handbook has extensive. What should my relationship be to that handbook? If I don't have a coach, for example.
Keep it.
Keep it.
I actually brought it with me. It's called Medicare and You.
Yes,
It's my
yes.
Bible. It's on
a
my
Bible.
desk. I
Okay.
look into as I said, Medicare is very complicated.
Yeah.
Sometimes I feel
It's
like,
not a small booklet.
no, it's 150 pages. or so. And they come up with a new version every year when you're enrolled.
Really?
My mom is 85 and she's living, and when it gets sent to her, I grab it. So it's on my desk, and I tell people keep that. It's very important. Again, when you don't have a coach or somebody that can help you,
Yes.
you certainly want to navigate through that booklet.
Okay.
And definitely keep that. It has every little nook and cranny on Medicare that you want. So
Really?
So when somebody enrolls in Medicare, you get a red, white, and blue card. That's your Medicare card, and you'll get that Medicare and You book to keep that. So that's a great navigating tool.
Okay. So, but back to the Part D drug stuff. Okay, so I'm taking this list of drugs, and now because of this list of drugs, we have to start choosing plans based on the list of drugs that I'm taking?
Correct. Your combination of your overall drug list is really what determines what drug plan you choose. It's which company gives you the best value, the best copay for your overall list of medications. Now, you could take one out and add one in, and it could come up with a totally different drug plan. And that's why it's very important to do an annual review. The Medicare open enrollment period is every fall, October 15th through December 7th. And that's why it's very important to do a review every year. Your medication list can change. The plans can change. New plans come out. Plans are eliminated. And so it's smart to do a review every year and see if there's another prescription drug plan that might make sense.
So in addition to the complications we've seen so far, we have to embrace changes every year and explore these changes every year to see how we fit into these changes.
Correct.
Do the drug plans specifically, but other plans also, do they typically change every year?
Every year.
Really?
They could change their formularies. One year, they might have a drug that's covered. The next year, it's not.
Interesting.
And so, and a lot of times, these insurance companies they change their pharmacy relationships. So, when somebody is choosing a Part D drug plan, there are 4 different factors I say to consider. Number 1, what's the premium of the plan? In 2016, the premiums range as low as $18.40, and they go all the way up to about $140 a month. Second factor, does the plan have a deductible or not? Some plans have $0 deductibles, some have up to $360. Then the third factor, which I consider is the most important, which company gives you the best value, the best copay for your overall list of medications? And then the fourth factor, which I've added in the last couple of years, is choice of pharmacy. A lot of these insurance companies now have preferred pharmacy relationships. So if somebody's accustomed to going to CVS, it's a normal procedure, you go to CVS all the time. But if you have, I ask, what's another pharmacy that might be close? If you have a Rite Aid or a Walmart, you'd be surprised that there could be a significant difference of cost.
Wow.
Yes, I worked with somebody the other day, and it was CVS and Rite Aid. Again, it's a particular plan that came up. It was an $800 difference
Wow.
of copays. So I don't want somebody to change their pharmacy, but if it's worth the price of gas,
Sure. Sure.
certainly help people save their money. So the insurance companies are supposed to send out changes to you, annual notification of change, otherwise known as ANOC, and anytime they change their formulary, change their preferred pharmacies, they send those out in the mail to you.
Sure.
A lot of times people think that's just junk mail, so they don't open that.
That's what
So-
I would do.
So those on Medigap and Part D, those are things you want to consider. When you have a Part C Medicare Advantage plan, again, it's a managed plan. You want to pay attention and ask your doctor. Make sure if you have a Harvard Pilgrim HMO, you want to find out from your doctor's office during the open enrollment period and make sure that they still participate in the plan.
Sure.
Again, the open enrollment period in Medicare is every fall. What that really means is a period of time where you can change your plan for January 1st. It's October 15th through December 7th. And that's where you have to pay attention to your drug list if it changes. Are my drugs still covered? Is my doctor still participating in the Part C Medicare Advantage plan? And so you really have to do your homework and stay above that.
Now, you mentioned, the last one is my doctor still participating. In your view, you've been in the area. Do doctors go in and out of Medicare, or accept and not accept, or are there more doctors coming on, or more doctors leaving? What's the tendency there?
Good question. I get asked this a lot.
Okay.
In Medicare itself, right now there are 690,000 doctors throughout the country that accept Medicare. In the last couple of years, there's only been less than 2% who have started to not accept Medicare.
So the number is, I think, is the number going down?
Small.
Or is it?
It's small. There are 10,000 people a day that are becoming 65 years of age.
Yes.
There's a big market out there.
Yes.
In again, I get asked this question a lot. In my 6 years engrossed in Medicare, I've only seen a handful of cases where people do not accept Medicare.
Okay.
Now that's on Medicare itself. On the Medicare Advantage plans, Part C, they're managed plans. Yes, doctors switch networks quite a bit.
Really?
Yeah,
So you have to pay attention to your doctor.
You have to pay attention on websites, doctor hospital websites. They don't say what Medigap plans they accept, because if they accept Medicare, they'll accept any Medigap plan. It's the Part C Medicare Advantage plans that they advertise. We are in the network for this plan.
Okay.
So you have to pay attention to that, and if you have a Part C Medicare Advantage plan, stay in contact with your doctor's office. That way you have to pay attention to that they still accept the terms and conditions and participate in the Part C Medicare Advantage plan. Again, they're managed plans where you have to pay attention to the doctors and hospitals. On Medigap, any doctor or hospital that accepts Medicare.
So I can see the apples-orange comparison between Medigap Part D and the Advantage. That's a critical difference right there.
Correct.
Yeah.
Correct.
So, someone's nervous about making these decisions. Can you go the Medigap Part D route and switch to the Advantage later on and at a subsequent year?
Very good question. Again, yes, you can. It's a matter of state to state as to whether you're eligible. For instance, actually, I usually get asked that question in the reverse. Can I sign up for a Medicare Advantage plan and then get a Medigap in Part D?
And later, yeah.
For instance, in Massachusetts, let's bring that up. It's a guaranteed issue state. There's only 3 guaranteed issue states in the country: New York, Connecticut, Massachusetts. That's where if you sign up for a Part C Medicare Advantage plan, and then something happens health-wise, and you realize, geez, I want to get the Medigap, in these 3 particular states, you can switch to Medigap in Part D.
Even midterm.
No, you have to wait till the
Okay.
Medicare open enrollment period,
Okay.
October 15th.
Okay.
But in the 47 other states, including New Hampshire, when you sign up for a Medicare Advantage plan, and then you don't like the plan or something goes wrong, your health declines, you can always consider moving to a Medigap in Part D, but you have to be approved medically by the insurance company.
Interesting.
And oftentimes it's on the application. It's not you don't have to go to the doctors, no blood test or anything. It's really questions on the application. It says if you answer yes to any of these questions, you do not qualify for this insurance. So again, it's state to state.
Sure.
But when we do our consultations with people, we certainly wherever somebody is in the state, you need to know your state rules.
Sure.
You need to know whether, you
So-
can change or not.
So even though it's a federally mandated program, where you live, the state you live, is going to affect details of what you're doing.
Correct.
Okay.
And what carriers are available to,
Mm-hmm.
how many plans are available. On the Part C Medicare Advantage plans or Part D drug plans, it's based on your zip code, what's available.
Is that regional?
Yeah.
Okay.
For instance, I keep mentioning New Hampshire. I know we're in New Hampshire right now.
Yeah.
You could be in one zip code in Nashua, and there might be 9 plans available. You can go up north to
Concord?
and there might be 3.
Interesting.
So it's all about on Medicare Advantage plans. It's all about your zip code.
Okay. There's a lot of mobile older citizens that are traveling around the country in RVs and stuff like that, just simply enjoying life. They have no permanent address or whatever have you. Or maybe they do, but they're never there.
It's where you pay your taxes.
It's where you pay
Where
taxes.
your license is out of. Yeah.
Okay.
That determines what states you have to get the plan from.
So even if I'm traveling, it's where I pay my taxes.
Correct.
That's what determines it. Okay.
Primary residence.
I think I'm almost ready for the quiz you might give me. However, what I wanted to discuss, it's nice to have our health benefits taken care of like this, but there are some of us who don't feel that the implementation has lived up to the promise. You've been immersed in Medicare. What's some of the more frustrating elements of Medicare for you?
For me,
as a coach, what's some of the ways Medicare tends to be frustrating for you?
Part D.
Part D.
Part D is I do a lot of seminars and webinars, and there's one page that I do that I can see I lose people in there, and that's where it's Part D. So in Part D, this is again, it's very complicated. In Part D prescription drug plans, there are 3 different coverage levels, which every company has to face. If it's a standardized Medicare plan, they all have to follow the same formula. And the first is what's called your initial coverage level. That's when you start, whether it's January 1st or you start July 1st, you start at $0. The initial coverage level goes from 0 to $3,310. So in other words, if you have a drug that's, the full cost of the drug is $100. The insurance company pays $75 and you pay $25. $100 goes towards that $3,310. Okay? So if somebody's taking generic medications, simple medications, you're never going to reach $3,310.
That's right.
It's for people that are taking brand name medications, multiple brand name medications, injections, inhalers, specialty drugs, tier 4, tier 5 drugs. It's the full cost of the drug. If and when you ever reach $3,300 in a calendar year, then you get to the second level, which is called the coverage gap, otherwise nicknamed the donut hole.
Okay,
And,
I've heard of this. Explain this to me.
And the donut hole is a period of time when your costs can go up. Currently, right now in 2016, when you get into the donut hole, it's almost as if the insurance company pulls out, and now you're paying 45% of the cost of brand name medications and 58% of the cost of generic medications. So for instance, that $100 drug where you were paying $25 in the initial coverage level, when you get to the coverage gap, you're now paying 45%. So that goes up to $45. And the one thing on the coverage gap donut hole, again, I'd say about 10% of the people, I do a lot of drug plans for people, about 10% of the people I ever see even getting in this coverage gap. Health and well-being for companies has increased.
Yes.
Medication management has increased. The doctors and hospitals certainly know about Part D drug plans now, and you want to stay on as many generics as you can.
Sure.
Sometimes you don't have the alternative opportunity to do that, should I say. But again, it's brand name medications that get more expensive.
Okay.
And that's what gets you into this coverage gap donut hole where your costs can go up. Every year, this coverage gap is shrinking, and they say by the year 2020, it'll be totally gone.
Okay.
So there's something to look forward to.
Okay.
So it's it's all about what your combination list of your drugs are.
Sure.
That determines whether, if, and when you ever reach this coverage gap donut hole.
Okay. Another problem that I've heard is all the paperwork that's needed to understand what's covered, what's our benefits. I was admitted to the hospital. Is that covered? I was there for a week, or The complication that people have to address sometimes, I've heard a lot of pain points on that complication. Can you
Yeah,
speak to that?
this is a good question. Inpatient hospitalization. Here's one that's really come up in the last couple of years. In Part A, it is inpatient hospital coverage. So when you go to the emergency room, you have to be admitted to the hospital for it to be covered under Part A. A lot of times, there's a thing called observation. When you go to the emergency room and they put you in the back room, and that's called observation period. You're not covered under Part A. You're covered under Part B, which is outpatient services, your medical services. You have to be admitted as inpatient, and you have to clarify this with your doctor. Am I inpatient? If it is, you are now covered by Part A. So that is one. That's a pain point, should I call it?
Okay.
Because I've heard of cases.
Does it make a difference which A or B, which one's covering you? Does that make a difference, really?
Well, it does if you just have original Medicare. There's to go down this road, in original Medicare, there are a lot of holes, a lot of co-insurances and deductibles. Most importantly is in Part A, if you go inpatient in the hospital, you have a $1,288 deductible. You have to satisfy, whether you're in the hospital one night or up to 60 nights. So that is in Part A, that is kind of the major cost, should I say.
Sure.
And then in Part B, there's a smaller deductible, an annual deductible of $166, but you're responsible for a 20% coinsurance, which is unlimited. Group health plans often have what's called an out-of-pocket spending limit or an out-of-pocket max, which is kind of a catastrophic number that if your copays, your coinsurances ever reach that amount during a calendar year, then it caps off and you're covered 100% for the remainder of that calendar year. But in original Medicare Part B, that 20% is unlimited. So, and I've seen some cases of people that just had original Medicare, they got a $100,000 bill.
Wow.
20%. So that's what those are things to consider. So another pain point, should I say, in Part A too. Also, in Part A is not only inpatient hospital coverage, it's also skilled nursing care facility coverage, like a secondary or a rehab hospital, hospice care, home health care, and blood while you're in the hospital. But on skilled nursing care facility coverage, you have to be inpatient. Medicare covers you for the first 20 days at no cost. Then days 21 through 100, you then pay $166 per day. You have to be inpatient in the hospital for 3 days in the eyes of Medicare in order, when you release to a skilled nursing care facility coverage, in order to have that coverage. If you're in 2 nights and they send you to a skilled nursing care facility, you're paying yourself.
Does that skilled nursing reimbursement also cover when nurses come to your home?
No, that's skilled nursing care facility is inpatient.
Oh, okay.
So that's so again, Part A is inpatient hospital coverage when you're in the hospital. Skilled nursing care facility coverage, the secondary or the rehab hospital after hospitalization.
That's also Part A.
Yep. Hospice care if you're deemed terminally ill within 6 months, and that can be at your home or at a facility. And then home health care. That is the occupational, speech, and physical therapists that come to your house after hospitalization, are really just short-term care, and then blood while you're in the hospital.
Okay.
So that's all a Part A.
So I have to, it just seems to me I would be confused as to which is Part A, which is Part B, and so. Now, you've mentioned several times a Medicare coach. This was a concept I had not heard of, but I'm not necessarily in the market. What is a Medicare coach?
Medicare coach consultant. I am privileged to be in the business that I'm in because there aren't many people that do what I do. And what you want to do, Medicare coach, you shouldn't have to pay for.
Shouldn't have to pay for.
Shouldn't have to pay for. You should have somebody that represents several insurance companies. So you have somebody that's in tune in the business. When I say represents, they're appointed and certified by several insurance companies. So you have somebody that not only is on top of the Medicare changes from year to year, but also somebody that represents all of these companies. So when I say Medicare coach or consultant, number one, they're going to help you enroll in the plans. They're going to help you with the road paths available. They're going to help you with what carriers are available in your area. And then when you pick and choose your plan, why I say there should be no cost, is because if somebody is appointed and certified with these companies, we
They get paid by the
we
company.
get paid by the insurance company.
Okay.
So you don't ever want to, you shouldn't have to pay a fee to a Medicare consultant because they get paid by the insurance companies.
But when under that arrangement, wouldn't it be likely that they would restrict their products to that which they represent? And I don't know if that represents the entire sphere of products available in the area, or how does that work? They're going to push the insurance companies that they represent. There may be others out there. I don't know.
That's why you want to get somebody that represents several.
Okay.
When I'll just veer off here.
Sure.
When I got into business right out of college, I worked for Mass Mutual in Boston. I started off as a life agent. I represent just Mass Mutual. So it was Mass Mutual, Mass Mutual, Mass Mutual.
That's right.
If you represent 15 Medicare insurance companies, it takes away any sales approach.
Sure.
You outlay all your options to somebody. They identify what road path they want to go down. And then if you have several options to them, you shop around for them and help them find the plan that has the best rate. So that shouldn't be, if somebody represents all the major carriers, Humana, United Healthcare, Harvard Pilgrim, Fallon.
Okay. Then that's
Silver
not really
Square.
an issue.
Yeah, you want to have all of those in your bag.
Okay. Now, but beyond, so a Medicare coach will help you enroll with the best sort of options based on your drugs, based on your lifestyle. But after that, I'm still fearing all the paperwork I may have to do, or this annual review I have to understand. Does Medicare coaches help there too?
Correct. Yes. If somebody's appointed and certified with these carriers, then that Medicare coach consultant will do all the paperwork for you.
Well, now there's paperwork and signing up for the plans.
For the plans, yes.
Okay, but there's also another area where paperwork is considered rather heavy in terms of just collecting the hospital bills and understanding what you've been covered for, understanding what you're responsible for, what the insurance, just understanding the benefits you're going to get and what the insurance companies will reimburse and what they will not.
Correct.
I'm told, I'm not doing this myself, but I'm told that there's a lot of paperwork just simply to understand what needs to be paid and what doesn't need to be paid. Does a Medicare coach get involved in this?
We can, yes.
Okay.
And those are called explanation of benefits. So when you have something, you go to your doctor, hospital, you have something done, it goes through the insurance company, then the insurance company sends you the explanation of benefits. And it's going to say what was covered, what is not covered, and how much you owe in the bottom. Good question again, Lee. When you have a Medigap plan, Plan F is the highest plan. Again, as long as your doctors and hospitals accept Medicare and what's being done is Medicare approved, Medicare pays first, the Medigap plan pays what Medicare does not pay. So when you have that explanation of benefits,
Doesn't matter.
it should say 0
Yeah.
on the bottom.
Yeah.
It's when you have a Part C Medicare Advantage plan, again, it's a managed plan. So the private Medicare is going to pay, the private insurance company, should I say, is going to pay what is on you. Now, when you sign up for a Medicare Advantage plan, you get kind of a menu of benefits. It's going to tell you what your copay is for a doctor visit, what's your copay if it's PPO, in-network versus out-of-work,
Sure.
emergency room, outpatient surgery, what it costs per day in the hospital. So you have the numbers in front of you on a Medicare Advantage plan, and then when you get the explanation of benefits, there's your answer. There could be some discrepancies.
Ah, yes.
And then you have to go to the insurance company.
Okay.
When somebody's by themselves, you obviously have to handle this by yourself. And, calling insurance companies is a lot of
people
fun.
handling things by themselves.
It's a lot of fun.
Double billing and things of that sort. But these are hospital areas, and they happen Medicare or not.
Correct.
So these are not specifically Medicare related.
Correct.
But managing the benefits you get, how much you have to pay. I've heard a lot of pain points there. A consultant can help with this. Tell you what to collect for paperwork, where to put it.
Yeah. What to look for. When I help somebody enroll in plans and they kind of get in the cards and I kind of have my temporary partying with them until the open enrollment period.
Yeah.
I say to them, going forward, anytime you're having something done, whether it sounds a little foreign language, whatever procedure it is, 2 questions to ask. Always ask, is this your doctor or hospital, is this covered by Medicare? Because if there is, then there's no surprises later.
Okay.
Once in a while, as I mentioned, this Plan F, people have first dollar coverage. And once in a while, I get a phone call saying, Ted, you told me that I shouldn't have to pay anything additional for doctors and hospitals. I have a bill here for $171. Well, we find out that that procedure was not covered by Medicare. So those are things that going
okay.
forward, what is covered by Medicare. Also, you know, your doctors and hospitals should know that.
Yes.
That's why you have to ask those particular questions. Is
So
this
you always have
covered
to ask, is this covered
by, is
by
this
Medicare?
covered by Medicare? That way there's no surprises later.
Okay. In that, so many of us are coming into Medicare age, I say. This issue, the whole issue of Medicare, signing up, taking advantage of it, you know, the benefits, what's covered, what's not covered. This is going to, because of the changing demographics, this is going to become a rather common topic in the population. You know, like, I can't imagine Medicare, one, not changing. I can't imagine the dialogue on Medicare quieting down. The politics seem to be, you know, putting focus on Medicare. The future for Medicare is what? It's uncertain in terms of, well, it's uncertain that it will stay exactly as it is now. I don't think that's likely, considering the political arenas and the changing demographics. What sort of preparation do we all need to make for the future? You know, we know the donut hole's going away. That's just that's a trivial thing in relation to the question I'm asking. The larger structure of Medicare, can it stay as it is with so many of us hitting that system?
I think it's only going stronger.
Really?
You know, as I mentioned, there's 49.5 million Americans that have it now. And in 14 years, 2030, supposed to double almost to 80 million. Again, 10,000 people a day are turning 65. So there's a lot more focus on Medicare.
Yes.
And
the resources that Medicare will consume will be larger as well.
Correct. And more insurance companies are going to offer it. I've seen it nothing but improve since I've been in the business.
Really?
I mean, again, as I mentioned, the coverage gap donut hole.
Sure. More
plans, more companies are now offering Medicare, more enriched plans, more Medicare Advantage plans being offered, more drug plans being offered, more Medigap plans being offered.
Okay.
So I'm comfortable because there's going to be a large growth with that.
Yes.
I see.
So you think it'll be able to accommodate fairly easily the changing demographics?
Correct. Yes.
Okay.
Yeah.
Okay.
I mean, every year it's very political too. Part B, is a Part B premium. What last year was $104.90, the standard premium, if you had that first income level. They were supposed to rise it to $159.30 this year. There was a lot of political back and forth, a lot of people opposing it, people going up on the Hill, and they reduced it, so it's now $121.80. So there's a lot of people touching Medicare.
Well, I've certainly learned a lot here, and I hope my viewers have as well. I really want to thank you for coming along and shedding some light on this whole area. It's confused me. We're going to have, where can people find out more about you?
Sure. I work for Borslow Insurance. Borslow Insurance is based out of Methuen, Mass. We are an employee benefit company to over 320 companies, so we're primarily an employee benefit agency, anything from active group health insurance, long-term disability, short-term disability. I handle the Medicare for the company,
Sure.
retiree solutions, and my do you want an email address?
We will have all in the credits and at the website for this show. We will have all of the information. You can get in touch with Ted directly, or you can make a comment on the website, and he may respond. I will try and encourage that. But we'll have all the information, things we've mentioned in the show, .gov, the handbook, a number of other things. I'll put them in the website show notes for this particular episode. And so I really want to thank you. I've learned a lot here, and
Thank you.
I'm hoping that my education continues as well as for my viewers, because I'm sure there's more to learn here.